Hi guys, Amy Wood joined by Dr. Cedrek McFadden, our 7 News medical expert, and we're here to talk a little bit about going back to school and what it's going to be like for children in terms of the illnesses that are associated with students being in school, and especially in this age of COVID-19, Dr. McFadden. I mean, what really should parents and students be on the lookout for?
Well, first of all, I think that the common illnesses that people see when we go back to school, such as the common cold, the flu, strep throat, pink eye, and lice, many of these can produce symptoms that obviously are going to raise flags for COVID-19, such as fever. But keep in mind that most of the time, if your child has any illnesses, it's likely going to be related to one of these minor, very common illnesses and not COVID-19. But I promise you, that's not going to stop many parents from being really afraid or concerned when their kid comes home with a cough and fever.
You know, we've already heard from some of the school districts about how they don't want you to send your child to school with any symptoms because it just becomes a complex situation they have to deal with.
Yes.
And obviously they're going to isolate people if they have anything that sounds even remotely related to COVID. They're going to protect and go that route. So what do parents need to know about sending children to school with any kind of symptoms? I guess not recommended.
Yeah, so the first is if your kid is having any fever, it's recommended, even before COVID, it was recommended, do not send your child to school. Even with the fever, we're talking about a temperature greater than 100.4. And we also don't want you to send your child with a fever after you've just given them some sort of fever-reducing medication, whether that be acetaminophen or ibuprofen, because what may happen is once they return to school after several hours, they may develop a fever and you're going to get another phone call from the school saying it's time to come pick up your child. So fever is one of the really big ones, even before COVID, that you don't want to send your child to school with, because again, it could mean they're still infectious and can put other children in harm's way.
You know, you could wind up with a child who has the sniffles, like a cold or something, right? They're sniffling, they go to the nurse's office, they get sent home. Then some schools are asking, we've got a handful of those already saying this in the upstate, that are saying you have to prove or provide proof that this is not COVID before you can come back to school. So if you do send your kid to school for a cold, you could wind up, I guess, having to wait out some doctor's note or maybe even a COVID test. I mean, do parents have to prove that the child doesn't have COVID?
Well, the CDC currently, they do not recommend that schools have this sort of policy in place that you have to have a result in order to return to school. But let's think about what's good practice here. If you have a child that has symptoms, or if the child has a close contact, or had the child had, traveled to a very endemic area where COVID-19 has been prevalent, that makes probably good sense to contact the pediatrician then, regardless of what the school may require. It may just make good parental sense to send that child or talk to the pediatrician at first to say, are we in danger here? Is this something that we need to be concerned about before sending them back to school? But again, according to the CDC, that's not generally recommended, but that doesn't mean it doesn't make good sense to do it if you're really concerned about the health of your child.
When it comes to how long students should stay out, depending, of course, upon their symptoms, how long should they stay out? When is the right time to send them back to school?
With fever, it's 24 hours. You want to have a 24-hour fever-free period. But let's talk about some of the more minor things, such as nausea, vomiting, or just a GI upset. It's very common when school is setting in. Well, you want to make sure that, especially with vomiting, that your child can tolerate liquids or food. You don't want to send them to school where they're barely taking in water and they get to school and they get really sick once they try to take it in. So that may be more than 24 hours. You really have to just monitor those symptoms. When we think about things like a common cold, where there could be other symptoms involved, such as a cough or sneezing, even if the child is feeling well enough to go to school, which could be a reason to send them back to school, if there are other symptoms that are prohibited, meaning if the child's having lots of sneezing, lots of coughing, to where it becomes interruptive of not only their learning, but the other students, it may make sense to keep that child at home until their symptoms are better and they're able to better tolerate and learn while they're at school.
When it comes to the way kids are going back to school, we already saw in the upstate as some of the first students went back, parents submitting their back to school picture, which is the child with a thermometer to their head as the school nurse checks them on the way in or whatever. It's a whole new world, right? They're going to be asked, sometimes in certain schools, screening questions. Sometimes they have to give their temperature. I mean, there's a lot that's changed.
Yeah, it has changed, but keep in mind that there can be up to 16% of children will not have any symptoms at all. So these types of screening tests, they're not all inclusive. It is very much recommended that you take temperature screenings at home, whether or not you're keeping a log at home, and certainly the school perhaps maybe doing some of the same. That is one of the better ways to do it. You're seeing your child perhaps more than school will see them, certainly at night, on the weekends, so you're keeping track of those types of things, and knowing that the screenings that they do at school may not catch all of these students that may have some symptoms.
Well, we appreciate you joining us, Dr. C, because, I think parents get a little nervous, the kids are a little nervous, and just
Yes.
talking it through is half the battle. We wish everyone a safe and healthy new school year.
Very much so. Thank you, Amy.